Our talk next is, I think, one of the most interesting conversations around which the entire seminar, the entire conference surrounds. What does it take to build a smart and sustainable hospital? And to deliver that talk, to share his perspective, we have Dr. Joy Basu, Vice President, Apollo Gleneagles Hospital, Kolkata. May I please invite you on stage, sir?
Good afternoon and namaste. I think after lunch sessions are always a little interesting. Like half of the people would be dozing. So my job would be a little challenging to keep them awake and concentrating on what I am talking about. I've given a responsibility to talk about smart and sustainable hospital. And I've chosen a very specific thought, like from morning onwards, we all are listening that technology can bring a lot of changes and actually technology can make a sustainable hospital. I don't think, okay, let me give you a small list. I'm going to talk about all these pointers. One is the cycle of life. What is cycle of life? I'm talking about from birth to death, from wellness to illness, from hospital to home. So the current scenario of healthcare is actually when we are taking it throughout. So we are not only concentrating on a hospital-based care, we are concentrating on a holistic care which keeps you healthy, happy. That's the wellness component of it, and the critical illness component which drag you towards the hospital. So I'm trying to cover up the entire cycle of life through my small presentation. Second, the smart infrastructure. I think infrastructure plays a major role in taking everything forward. Hospital infrastructure is a very specific infrastructure. I think in the welcome note of Dr. Desai told that the hospital is not just like a hotel. It's completely different. Hotel, every room got a specific temperature, specific airflow, very standardized. But hospital, it differs from place to place. We all know. Like cath lab got a specific thing, NNICU got a specific thing, OT got a specific thing, even ER got a specific thing of air change rate itself. So in my opinion, hospital infrastructure and hospital architecture is completely a different subject altogether. Like any building cannot be made hospital on overnight. So it needs a lot of thoughts, a lot of efforts, a lot of challenges into it. Then I'll come to the digitalization. Digitalization is, I'm just talking about the data mining, big data, siphoning the data. That's not enough. We need to utilize the data. Getting a piles of data is not going to help us in any way. So we need to utilize those data into our system, into our day-to-day life, and to make things easier. I'll tell you a small example how the digitalization and technology is easier for a consultant to deal with a patient. My very pet topic is the digitalization, so I'm not going to spend more time because my time slot is only 30 minutes. Let me start. Just few days back, I was in a seminar in Hyderabad. There, IBM Watson, they came with a small gadget. They came with a very small gadget. It looks like a small microphone of Sennheiser or Bose kind of small microphone. That's being placed in the middle of a table of a consulting room. And patient is talking about his illness, about his history, about a lot of things. lot of his family things, lot of things patients are talking, and doctors are replying a certain manner. After that, doctor is telling him that you have to take this medicine, A, B, C, D, E, you have to do this test, you do those tests, come and visit after 7 days. That intelligent piece of material is a wireless device which is placed over there that is capturing the entire conversation and make it a digital prescription out of it, taking all the unnecessary talks out of the subject, not to type all those stuff, and making a digital prescription. A printed prescription, doctors are getting that printout, is signed and giving it to the patient. So I was present as a panelist and then as a guest. So I was having a separate chat with him, who came from IBM Watson, outside the gallery, and he was telling me some surprising stories, like it is not only the voice it is capturing emotions, it is capturing sentiment, it is capturing lot of other things which is not told. It is by the pitch, by the sound, by the modulation of voice. So that equipment is so intelligent. It is not in market right now. I should tell it at first. It is not in market right now. That instrument is so intelligent that it can capture those things and make it a printed prescriptions. Today, when I am doing in my smartphone, just talk to text or those kind of thing, it gives me at least, I think it is 50% correct result, 50% are something else is typing. So I don't know how they are doing, but it's all with big data, it's all with machine learning, it's all with artificial intelligence. So I was telling him how you can come up with the emotional component of the conversation into the total prescription matter. He's telling that also is an neural network system. It's an artificial neural network system that what they have developed, that to ease the doctor-patient relationship, to ease the confidence, take the confidence and the trust towards the patient. So that's more important than going just simply for digitalization's sake, I am doing digitalized. For doing a typing prescription, I am doing digitalized. It's not like that. Digitalization or smart technology has to be adapted for some purpose. Like it has to be stored for a certain time, it has to be in cloud, it has to be accessible to a lot of people. People can migrate from one city to other city, so he can carry his own digital card with him, he can go to some other hospital, flash the card, he get all his clinical data inside the card. So that's digital. So it should help me in some way to sustain. So that's one example. I thought of giving only examples over here because time is not that much to give him the total detail and how the algorithms, because I am associated with actually number of companies and number of institutes basically to work on all those things on a ground level. So I'll tell you a small example. We all use our mobile cameras to click pictures, right? So one individual, he is with MIT Sloan. He basically American. He came to our hospital, Apollo Gleneagles Hospital, to do a combined study with me. So what he's doing in his media lab, only with the help of a smartphone and the camera and his finger, just if you switch on your camera, put your finger on the camera, you see a red screen on your smartphone. With the red screen itself, he's getting 14 to 17 health parameters through a app what he's developing. It starts from various things. It starts from blood pressure to capillary blood flow to oxygen saturation to hemoglobin to blood sugar. Huge number of things. So what for he came here? He came to a third world country to just get it validated with this kind of population. Because India, we got a mixed population. We got Caucasian, we got Negroes, we got everything. We got different colors of skin. So he's doing that study. Hopefully that thing will come into market in very near future. I'll tell you a small story. Just few days back, one of his students came to me. He has developed one small probe. It's a universal ultrasound echo probe. I never seen such a probe in my lifetime. So I said, how it will work? Well, sir, it will work with your smartphone. Well, with my smartphone? Well, just put it inside your C port. We have only done it for C port. So put it into your C port. Your phone display would be working as a display for ultrasound and even echocardiography. So you just carry that probe into your pocket and you can be a cardiologist or a radiologist. At any place, any time, it can be at residence, can be at hospital, can be at hotel, anywhere. So easy. So what I'm planning to tell you in this forum, that healthcare is going to be minimized. Healthcare is going to be pocketable. You can carry healthcare, a lot of gadgets with you. You cannot carry an ultrasound machine or a CT scan with you, but simply you can carry a lot of things. In today's day, we don't go to a lab to do our sugar test. We can do it at our home. Just a single prick, sugar is done. But I'll tell you, within 2 to 3 years' time, half of the lab test can be on app-based system. Media lab is going so fast in that way. Because it's painful that for last 25 to 30 years, healthcare is not developed what it should be. Like in my morning presentation, I was telling all of you that when my father was doing his internship 35 to 40 years back, that time also he used the same kind of stethoscope, he used the same kind of prescription, same thing. So today also we do the same thing. People in the queue, they go inside, prescribe some medicine, go to a medicine counter, jot down all the drugs, all the packets are filled, he goes back home, he does a battery of tests, that's extra here. He does battery of tests because clinical medicine has gone a separate track. Right now it's all validated medicine by a lab or radiology. So except that component, the entire thing is same in last 30 to 35 years. Why? Why I with a 72 kg body weight will take the same medication of someone with a body weight of 40? Why I shouldn't have any personalized medication with me which works only for me? Still, our pharmaceutical industry, if anyone is there, doesn't have any answer. Why 60% of the disease is not curable today? Taking entire spectrum of lifestyle disease, include diabetes, hypertension, cancer. You talk it out. You don't have a cure. I got diabetes, I take an injection and I am cured for lifetime. I don't have that. So, we need to work on that. Lot of sectors, I was discussing with him, lot of sectors have grown much faster than healthcare. We never thought we could have sent an email from a bus stop. We never thought just 3 years back. 3 years back, email means we need at least a laptop or a computer. But today's day, we can do it. We can click a photo, send throughout the world. So, but in healthcare, we got a lot of new gadgets, a lot of scanning device. which actually help the doctor, not the patient, which help the doctor to diagnose perfectly. But the patient got the same kind of treatment. He came with a pain, his pain got relieved. Patient का तो वही मतलब है, that's it. He came with a gallbladder stone, yes. There we got certain things like minimal invasive surgeries, like implants, like stents, absorbable stent, those stents, a lot of things have come in that arena. Robot has recently stepped in, but not fully in Indian market. So I'll go by my list. This IoT, Internet of Things, big data, robotics, 3D printing, personalized drug, cognitive computers. I was talking about IBM Watson, that is basically a cognitive computers. Then it's smart financial planning and smart healthcare. I think I've already exhausted 10 minutes. So as I said, there is no move, no change in healthcare in last 20 years. Stereotype healthcare delivery system, customer-centric versus doctor-centric, cure of lifestyle disease. Cycle of life. It's lab, primary care, again hospital, specialist, long-term care, public health, awareness, vaccination. So that's the cycle of life. So the future model should be any healthcare company like who are the providers, like hospital industries, they should look at every aspect of this cycle. Like on right-hand side, I have given the example of my hospital, Apollo Hospital. They have almost pitched in all these areas. You have seen that they got a pharmacy chain, they got a secondary care, they got a diagnostic separate, they got a bigger hospital, they got a smaller peripheral hospital. I think they have somehow completed the cycle of life in a holistic manner, but it needs to be further developed. Then technology. Technology is one of the prime movers for you. You can't deny technology. If you are denying technology, you are denying science. You cannot deny science on that respect. Today there was a discussion about the buying an equipment and thinking about ROI. Today's day, we'll buy a lot of equipment. We upgrade equipment, like 1.5 Tesla MRI be upgraded to 3 Tesla. CT scan, number of slides are getting increased every day. So that is giving much more accurate picture for the consultant to diagnose. Might reduce the length of the stay of the patient because he's getting diagnosed much quicker. But on the flip side, the out-of-pocket expenses are increasing. And it is increasing day by day due to a lot of factors. I'm not going into those factors like legal problem, litigations and other things. We must have a proof of blah, blah before starting must have a B positive thing before starting an anti-tubercular drug. So before, the things are completely different. Before we used to treat patient, the trust factor was there. I'll tell you a small example. Where I worked, Apollo Gleneagles Hospital, Kolkata, we got a consultant, a very senior orthopedic surgeon, because here a lot of doctors are there, that's why I'm giving an example of an orthopedic surgeon, but it's not an example, it's a real fact. He's #1 surgeon of this part of the country who does knee and hip replacement. So few orthopedics guys who are there, they know him very well. We recently missed him. So one day I was in his chamber. One patient came with lot of reports with CT scan, MRI, X-ray, full skygram and everything. So patient was carrying a bundle of file along with him and placed in his table. He has seen all the plates separately in his view box. He knows exactly what happened to the patient. Then he asked the patient to just go and lie down. I was with the patient, I was little shocked. So with MRI, CT, everything done, why he wants the patient to be examined? So patient was on the couch. He pressed the knee, this side, that side, folded the leg, this, that, stretched it, and then patient says, okay, now get up. Your operation is fixed on this date, this is the fees, this is the package, you go pay and get admitted. The patient goes up. I asked him, sir, you got every detail, every damn detail of his knee with the MRI, CT, X-ray, everything. Why you want to examine the patient? So he replied me back, I want the trust of the patient. I just got the trust of the patient that doctor is not going to see me only with pictures. Doctors are going to touch me, feel my pain, and then only do the surgery for me. It is not that I got a ultrasound report of a gallbladder stone and I tell him, okay, you got a gallbladder stone, go get admitted, and I'll do the surgery tomorrow morning. No. Patient has to lie down, patient has to fold his leg, patient has to be palpated, patient has to be seen properly by a doctor, then you do the surgery. So, what I am planning to tell right now, technology is not everything. You need human touch. There was a study by McKinsey just few days back. They have given me some soft copy. I was going through that can technology replace the human component? So the study says that yes, technology is needed. Technology is important for very specific things, not for everything. Because doctor-patient relationship is the final one. And they have studied that the duration of the time when the doctor and patient talks, that denotes the voice of customer much, much higher than any other technology. You might do it with a robot, you might do the surgery with laparoscope, you might do the surgery with anything. Patient need a cure, patient needs a communication, patient need a soft touch of a doctor. That we call it a healing touch. Now I come to the IoT. IoT, I think I told a lot of things, and he said in the morning a lot of things about Internet of Things, what he's doing from the computer to your tab to the data, from data to the cloud, from the cloud you can gather the data, you can get the data from anywhere, anytime. So that's the Internet of Things. We can integrate a lot of things. Now comes to the integration. There are connected device, there are teleconsultant, there are teleradiology. Today we are talking about more than teleradiology. Today we are talking about the teleclinics, we are talking about EICUs, we are talking about the condition management. Now come to the sensing device. I'll end my talk with this sensing device itself. We are actually doing a project on sensing device in a hospital. There are sensors inside a doctor's room, and patient is having just a simple wristband, and wristband got a RFID tag. When patient enters inside the room, his entire vitals is getting captured by the sensing devices, and that is getting uploaded and populated into the system of the consultant. So there is no need to do any kind of test like measuring BP, measuring pulse, measuring heart rate or this, that, everything is calculated just entering inside a room. So sensing has got a huge benefit in healthcare sector. We all use sensors. Like, all our smartphone is having not less than 6 sensors. So we all use sensors. I'll come very quickly about robotic surgery, robot-assisted nurse. Newer things, like the first one, you know about the bionic eyes. I don't think how many of the patients are actually using bionic eyes in the country, but it's still available. The patch devices which replace the injection pain. The second one is the patch devices which replace the injection pain. You put the patch and drug will get automatically absorbed into the skin. And the third one, the most interesting one, you know about the VR system, the virtual reality that you can play games and all those stuff. And this virtual reality is coming into the picture of laparoscopic surgery. You don't need a big screen for laparoscopic surgery. You just wear that, entire thing is there in front of your eyes. So, this all are help of Media Lab, mobile lab-based program, and other different things. So, I am not going into detail of other things what I supposed to talk, but I conclude my program and conclude my presentation telling just one thing. Hospital and healthcare will see a sea change in coming 2 to 3 years. So, all the companies who are there, just should think about it. I talked a lot about 3D printing, customized medication. I told about sensing devices, IoTs, lot of things. So think about it, tell your R&Ds to do lot of things. So we all can strengthen the healthcare model as such for our country. And life is priceless. Thank you.
Thank you so much.